Assalamu alaikum students. Today we will discuss nutritional focused physical assessment, functional assessment, assessment of the estimation of the energy requirement, how to calculate energy expenditure, protein requirement, functional assessment, measurement of the strength, nutritional focused physical assessment according to dietetics and nutritional terminology reference manual. Nutritional focused physical examination are the findings from the evaluation of the body system including muscle, subcutaneous fat, or breathing, appetite, oral health, and nutritional focused physical assessment is component of the nutritional assessment in nutritional care process. And nutritional care process model we already discussed, in which we do nutritional assessment, nutritional diagnosis, interventions, and then evaluation. In nutritional focused physical assessment, evaluation of the body system including overall appearance, vital signs in which temperature, pulse rate, respiration rate, blood pressure, skin, head, ears, eyes, nose, throat, or cardiopulmonary system, bones, muscle, arms, leg, digestive system, nerves. So evaluation of the whole body system. In nutritional focus physical assessment, we use different equipment including gloves, stethoscope, tongue depressor, scales, tape measure, weight machine, blood pressure cuff, clippers, and examination techniques and findings. The four basic physical examination techniques that are used in nutritional focused physical assessment. The techniques that are used in nutritional focused physical assessment including inspection and palpitation, percussion, and auscultation. In inspection, general observation including sense of sight, smell, hearing, or behavior, movement. In palpitation, like tactile examination to feel the palpitation, vibration, or assessment of the body structure, uh, texture, size, temperature, and in percussion, assessment of the sound. And this is not always used in nutritional focused physical assessment. In children, malnutrition is defined as imbalance between nutrient requirement and intake. If the balance between nutrient requirement and nitrogen intake is disturbed, if requirement is more and intake is less, then nutrient energy or energy, protein, micronutrient deficiency, and resulting impaired growth and development. So, assessing the malnutrition in children, standardized tools are used in we do assessment of the uh, height, weight, or if the infant, then we also assessing the health status of the mother, their socioeconomic status, all the aspects related to the nutritional assessment. Guidelines for assessing the malnutrition in adult. When we are assessing the malnutrition in adult, it is defined as a malnutrition syndromes, that is uh, dependent upon the patient settings, acute illness, surgery, chronic diseases, environmental, social circumstances, or the presence or the degree of the inflammation, or if the malnutrition is due to the inflammation. If yes, the answer is yes. Due to the presence of the inflammation, the cause of the malnutrition is inflammation. Then it may be mild to moderate degree, or due to any chronic disease or injury related to malnutrition. And in case of acute diseases, uh, maybe has initially start inflammatory response, or if not due to inflammation, it may be due to any other disease or the starvation related malnutrition. Functional assessment or measuring the functional status. So functional assessment is basically measurement that assess the skeletal muscle function, strength, and functional assessment is part of a nutritional assessment when we especially deal with those patients who are older or above the 60 to measure the strength, and or those who are bedridden or using wheelchair. So the basically the physical assessment or the functional assessment is to determine the muscle strength or functional status. Measures of the strength with the aging, imbalance cycle of the muscle synthesis and breakdown due to the atrophy of the muscle mass, the loss of the strength and power. We use a different instrument to measure the strength, and hand grip dynamometry. The most common or the specific assessment of the muscle strength is hand grip dynamometry, and the standardized simple for assessing the nutrition relation to the skeletal muscle function. In case of when we are using the hand grip dynamometry, the patient is asked to grip the dynamometry, and uh, hand grip measures has long been a part of the fitness assessment, and commonly used in nutritional assessment. Physical activity assessment is part of the comprehensive nutritional assessment. Lifestyle and behavior are the play important role in causes and prevention of the different diseases, chronic diseases, due to change or shift in lifestyle, use of the mostly stairs, lift, main causes of the obesity, diabetes, or other chronic diseases. These behavior increases the prevalence of chronic diseases, and BMR of the hospitalized patient may be affected by a number of factors, including fever or increasing the metabolic stress, or assessment of the energy requirement. And energy requirement basically based on a DRI, and different equations are used to measure the energy requirement. The dietary reference intake for macronutrient are standards of intake according to their age and gender. So DRI is include the estimation energy requirement, provide the guidelines to meet the energy need of approximately of 50% of the healthy population. And these values are not recommended for individual. These are for the population. For example, for the age group 50, according to their requirement, energy requirement is uh, 1600 calories for the, but this requirement is not for the individuals, and differ from if according to the patient, according to their disease and their body needs. There are the different equations that are used to measure the energy expenditure, including the muffin equation or the WHO energy expenditure equation, and mostly we use the Harris-benedict equation, in which we different equation for male and female. We use activity factor or the stress factor, depend upon the various conditions, and different methods are used to estimate the amount of energy need for physical activity, and energy requirement formulas developed by the Food and Nutritional Board, and stress factors. Stress factors also disease, infection, trauma affect the individual energy requirement. Hospitalized patients are hypermetabolic. Their metabolic stress are increased. Estimation of the energy intake according to their needs, and for activity factor, uh, who are out of bed is 1.2, or and average energy factors is for surgery is 1.0 to 1.3, in case of infection 1.0 to 1.4, in trauma 1.2 to 1.4, and head injury is 1.5, and they are different according to their needs. The requirement of protein in the hospitalized patient is influenced by nutritional status before illness, injury, the severity of stress or nitrogen losses, uh, or the well-nourished individual tolerate a few days of inadequate protein intake. The adaptive responses of the body in such situation is utilize the protein more efficiently and to decrease the expenditure. So in well-nourished or in healthy person, when protein intake is low, the body adaptation to decrease losses and utilize the protein, or but in case with patient or with any serious illness, injury, or not take calories or protein, unable to digest or ingest the calories of protein, then or case of the semi-starvation, uh, they are unable to maintain the balance because the body is already in stress or protein losses already. So in these conditions, the protein need is increases because of the extensive nitrogen losses, or in undernourished patient show less nitrogen losses as compared to those who are previously well nourished. So those patients who are well nourished, and then mm, they are due to any injury or any disease, their protein intake is low, so their nitrogen losses are more than who are undernourished, or their protein losses is low from 4 to 6 months. Uh, or when the nitrogen losses are not measured, and then we use the protein calories ratio, or if the nitrogen losses are measured, then nitrogen protein requirement is based on the urinary losses. And in case of the protein calories ratio, the energy provided by lipids or fat and carbohydrate and protein intake is reserved for the synthesis requirement. So, in case of the protein calories ratio, the ratio is 100 to 1 or 150 to 1. So, when we provided the protein according to protein calories ratio, the carbs and fat is provided energy, and the main function of the protein for other synthesis, or the to store for the other function of the protein. And this is not used mostly. We do protein requirement on based on the uh, body weight, or in the hospitalized patient and nitrogen losses. This method is not commonly used.